What's going on, you guys? So today is Saturday, and today is going to be medical insurance billing. Get these glasses right. So you guys remember that I said that we was going to kind of start something new, and I'm going to start doing some of the classes. Well, we are going to do classes on YouTube. I'm leaving the forum open in case somebody has some questions. The difference between the YouTube courses and the courses that are in the Sapphire portal is that those students have books and what they need to already do their courses. So at the first start of the course is generally the medical insurance billing. The book for the medical insurance billing is the Ford-Neat book, Medical Billing and Insurance. I'm going to put the link below so you guys can click on either Elsevier to get the book, Amazon to get the book, or thrift.com to get the book. So at the start of this course, this is just like we were in a classroom, just as if I was at the front of the desk and I'm giving you guys direction. Same thing, if you had your book in front of you, you guys would be at the desk looking at your book, and I would be up at the podium looking at my book. There's nothing different. Just you are not physically with me, I am not physically with you, but you can ask me whatever you want to on the side. If it's something that I think that the full class needs to know, then I'm going to answer it with the full class. Okay. Or, I'll send you an email if you want me to. So today we are going to start the first chapter in medical insurance billing. Now, we went over a couple of things as far as what we're going to do. So as you guys can see, last night, apparently the whole video, I thought I was really showing you, sharing some of my page. But because that stuff is encrypted, they won't let me really show you. But you will soon have your own book. Those of you who do have that medical insurance billing book, you're going to turn to chapter 1. Okay, it's chapter 1. And me showing you this is really how we do all the classes. It is the same. The curriculum is the same. You're going to do the chapter and you're going to do the task. So once I share this, I don't know if it's going to share. I'm pretty sure it's not, because I'm not doing it on the Zoom. We're doing it on the regular stream. Maybe there was something that I did not do correctly that it did not share. So what I'm going to do is I'm gonna look at it again. Let me see if there's something that I missed. Um, so I'm just primarily picking up. I don't want to do book. I just want to kind of look at the library. You may not be able to do it, but we're going to see. Um, I'm not sure what that is. Window? What window? All right, so we're going to cancel that. I have no idea. I have no idea what that is. So we got to play with that a little later. I got to make sure you guys can get that. But it doesn't matter. When you guys are doing your study, you're going to go through chapter 1. I'm going to pull it up. Uh, you don't necessarily need to see me because this one is live. This is live, okay? So I'm just going to go into my own share. And I want to go into the library. So we're going to share. Okay, so there's nothing really up here but a bunch of books that's up here. So the book that you're going to get is the 17th edition. Y'all write this down. 17th edition, Ford-Neys, Fordneys, Medical Insurance and Billing. Okay, the book is by Linda M. Smith. Okay, so that is what we are going to start with. Okay, and basically, this is just your overall um, first structure of me just going through this tab. Okay, so I know you can't see this, but only thing I'm doing is get into that first chapter that I just told you guys about. So the first chapter in this book is role of an insurance billing specialist. That's chapter 1. Okay. Now, this is homework for you guys. Okay, this is homework for you guys. So just imagine that I was in the front of the class. Okay, I'm not going to be messing with my face or anything because I'm looking at my screen. If you don't see the screen, then we got a problem. But you still should have your book. Okay, you guys should have your book. Okay, I'm probably going to do the next one in the Zoom. It may not be live. I'm going to do it in the Zoom if this doesn't pick up. So you guys should have a book. If you guys don't have a book, remember to go back to Sapphire ED CLS 1 because that's the first class that we are starting with. I'm going to try and be consistent with the days. Right now, this class is at 6:30, but it's between 6 and 7. I try to do it when everybody's already in. Okay, so in this chapter, role of an insurance billing specialist, you're going to identify the background and importance of accurate insurance claim submission, coding, and billing. Access the various roles and responsibilities assigned to insurance billing specialists. Okay? I'm not going to read all of them, I'm just giving you some. You're going to describe professional behavior when working as an insurance billing specialist. Okay? Describe the variety of career advantages open to those trained as insurance billing specialists. Okay, so generally, when you guys are learning the coding, there are some billing questions on there. So that's the reason why you have the medical insurance billing. I don't need to explain to you the difference between medical insurance billing and coding. Go read that medical billing and coding Q&A book and you will know. Okay? Right now, we are doing the medical insurance billing. Okay, so I'm up to key terms, all right? So if you guys have your book, and those of you who are archiving this, when you get your book and you're on chapter 1, just follow me along, just as if I was standing up in front of you in a classroom, okay? Your key terms are going to be accounts receivable, American Medical Association, cash flow, claim assistance, claim examiners, cycle, okay, dress code. I like that dress code one. Etiquette, okay, watch the etiquette. Sometimes we just say whatever. When most offices have etiquette, okay, especially when it's CS. Okay, so we looked at some of this yesterday. Senior billing representative, some of those things you're going to go over. So in chapter 1, what you're going to do is read chapter 1, okay? Take notes while you're reading chapter 1. Reception of the patient, rendering of medical services, documentation of the services, financial accounting. You're going to read these things in this book. When you get to scheduling appointments, right? You're going to see something there say an encounter. Pay attention to encounter, okay? Scheduling appointments involves assigning time slots for patient encounters. An encounter is defined as an interaction between a patient and a healthcare provider for the purposes of providing healthcare services. Okay? If the time is not properly assigned, there may be an influx or low volume of patients at a given time. Paperwork required for the encounter must also be produced. It is important to record why the patient requires healthcare services. So that is documentation. What do we say in coding, ladies? If it is not documented, it has not happened. Okay. Uh, what I'm going to do, because I can't split this up. I want you to make sure that you stay on track with this chapter, because this chapter is like the gusto of people who don't really know about medical insurance billing. Okay, when you get to the quick review, when you get to the quick review, okay, it says role of the insurance billing specialist. Several job titles are associated with medical billing and personnel. The professional title used may depend on the region within the United States. Okay, some of the most popular titles include insurance billing specialist, electronics claims processor, medical biller, reimbursement specialist, medical billing representative, senior billing representative. You hear all these different titles for a person who does medical insurance billing. In a large healthcare organization, it is common to find a billing department made up of many people within the department. Each position is specialized. Okay? Medical billing specialist, Medicaid billing specialist, coding specialist, insurance counselor, collections manager, financial coordinator, revenue cycle manager. In this textbook, the title insurance billing specialist will be used throughout to represent this broad spectrum. Now, if you get a question on your CPC, I'm going to take this down. If you get a question on your CPC, and they ask you about all these different titles, and literally you're going to say, what category does it fall in? Billing specialist. That's the category that it falls in. Okay. So I'm not sure if you can see me the whole time, but I don't care. That's how we're going to roll with it. Okay. So let me go back. All right. So that is crucial. Let me tell you why. Because I don't know if you guys can see me or not. I'm going to share that. I'm pretty sure it's not sharing, but this is the class. This is what I'm going by. Okay. And you should have your book. Okay. You should have your book, because there are like copyright issues and things like that. So that's another reason why I can't put this book on YouTube. Now, if I'm in the classroom and I'm teaching this in a classroom, it is different. It will allow me to share the book with you as the instructor with the class. Okay. So I'm not sure if we can do this way or not, but we'll find out. Okay, I gotta make sure I don't start playing with my nose and all that kind of stuff, because I'm looking at the book and you guys are looking at me. Y'all look at that whole video last night. Look at the whole video. Don't look at 2 minutes of the video. Look at all of the video last night. Okay, so job responsibilities. Now we just talked about medical insurance billing. We talk about medical insurance billing. Nothing to do with coding. Whether employed by a medical practice, a hospital, or another healthcare organization as an insurance billing specialist, the individual should be able to perform all duties related to the business office. The business office is where we do our work at, because it is the business of the office. Okay? All healthcare staff, regardless of whether they work in scheduling, registration, charge posting, or accounting, must work together to ensure a strong revenue cycle and appropriate reimbursement. Healthcare organizations have job descriptions to outline the duties, okay, the skills, the requirements for insurance billing specialists, okay, and other related job titles. All right. Now, this is just giving you a little bit about medical insurance billing. Now, we hear a lot on YouTube about the differences between medical insurance billing and coding. I'm literally laying it out for you. This is the difference. Okay. You don't have your book, make sure you get it. When you get your medical insurance billing book, you're going to follow with me. That book, remember what I told you, it's Medical Insurance and Billing, okay, by Linda Smith. That's the book that you're going to get. You can check out any college you want to. This is the book they're using, okay? If you want to get all your books at one time, you can. You want to get your step-by-step book, Get it at one time. You can check any college you want to. They use the same material that I'm about to give you on YouTube. Okay? The difference with this course is that you got to purchase the courses on my website. So go to sapphirecoding.com. If you got a key code, use it. Okay? I'm going to go through some of the tasks because the tasks go with this chapter. Okay? So you have this chapter that you must read. Okay? I'm going to I'm gonna stop sharing real quick. Let me just okay. So maybe that's why it does that. Okay, so just remember, you do chapter 1, you do your task 1. You do chapter 1, you do your task 1. Okay? I'm going to go back over here. So, in this chapter, okay, job responsibilities, abstract health information from patient record. We're talking about a medical insurance biller. Okay? That's what we're talking about, y'all. We also talking about follows employers' policies and procedures, exhibits an understanding of ethical and meteorological responsibilities related to insurance billing programs, transmits insurance claim accuracy, enhances knowledge and skill to keep up to date, employs interpersonal expertise to provide good working relationship with patients, employers, employees, and third-party payers. Okay, I'm not going to read out all of the performance standards because you guys should know that. Abstract health information from patient's record. Okay, that's one of the responsibilities. Performance uses knowledge of medical terminology, anatomy, diseases, surgeries, and medical specialties. Consults references, materials as needed. Meets accuracy and production requirements. Verifies with physician any vague information for accuracy. That's part of the job description as a biller. This is what you must know. This is what they are hiring you for. Exhibits an understanding of ethical and meteorological responsibilities related to medical billing programs. Performance observes policies and procedures related to federal privacy regulations, health records, release of information, retention of records, and statute of limitations for claim submission. 60 days, 30 days, 90 days. If you wait 6 months, you might have to write it off. That's what they're talking about. Claims of statute of limitations. You're either going to write it off, or if there's an adjustment, you need to adjust it. Okay? In this book, that's where you're going to learn that. Okay? I don't hold your hand. I'm giving you what they're giving you. This is just like I'm standing in front of the classroom and you all are at home in your room with your book. Okay? It's you who's going to make the change. You want to make the change? It's you who's going to make the change to learn this course. Okay? Y'all want it on YouTube? I'm bringing it. Recognizes and reports problems involving fraud, abuse, embezzlement, and forgery to appropriate individuals. Okay? You see somebody using somebody else's Medicaid card and somebody else's name is on it and they give you this crazy ID, even makes you say something. Okay? Because guess who's the last one in that EHR touched that patient account? We know. So you don't have to come clean with it. If you take that without verifying that stuff, you're going to get in trouble. Okay? Transmits insurance claims accurately. We talk about medical insurance billing. Nothing to do with coding. Okay? Performance updates insurance, registration, and account information. Processes payment and posts to account accurately. So check this out. So if you're working in the payment posting, you're going to be posting money. Okay, that's a payment posting. So that's what they're talking about right here. So again, they didn't mention that in earlier payment poster, but payment poster is part of the billing specialist. All right, she's still in the finance department. Okay, or he reviews and counter forms for accuracy before submission to data entry. They are talking about the intake form. When the provider is finished with the patient, he's supposed to put all his codes on there. The medical assistant is supposed to check that, make sure he signed that, make sure he's done with it before she even give it to you. Okay? So 9 times out of 10, it's supposed to be in the EHR anyway, but he has to sign off on it. So that's what they're talking about. Review and counter forms for accuracy. And then counter forms is just another name for intake, okay? Codes, procedures, and diagnosis accurately. Now, this is a good one. Medical insurance billers are not coders. Medical insurance billers can put codes in as charge entry people. Now they're asking for charge entry people to be certified, which I think is ridiculous because all they're doing is taking a piece of paper and reading the code and putting the code in. What is the problem? I told you the hardest thing y'all gonna do as far as coding, all this reading from the book and all these little just when you take your certification and then you start going to work, you ain't gonna be doing all of that. You ain't gonna be doing all that because you're gonna have a system right there. It's gonna be either Optum 360 or you have United Healthcare. Epic might have their own one. Okay, so those things are gonna help you do your coding, but you have to make sure you got that logic to know what you're talking about. But yeah, you're not gonna be in your books like that, but we still have books for you. Okay, because I don't want you taking 25 minutes looking for no code when all you got to ping, here it is. There's the code right there. Okay, you check it, make sure it's all right. Okay, so I'm not going to go through all of this. I just wanted to give you guys a bright idea of medical insurance billing and what it is and what we expect of you. I'm going to do this last one. Employees, that's not the last one, but I'm jumping down. This is a medical billing specialist. You want to know what a medical billing specialist is? I'm telling you what a medical is straight up. It ain't no, there's a big difference between medical billing and coding. All right, break it down. I'm breaking it down to you right now. This is the difference. Employees interpersonal expertise to provide good working relationship with patients. With patients. Coders don't work with patients. Okay, you will, as a biller, you will work with patients. Okay, now remember, you guys who are here for CPC, this is just an introduction for you. You just taking this because it's free. We giving it to you. Okay, but you don't have to. You can just bypass this. Wait 2-3 weeks till I get to the coding, and that's when we're gonna get to it. Because we ain't gonna get to the coding just yet. Okay, employer, employees, and third-party payers. Okay, what is she should be doing? What should she be doing? Work with employer employees cooperatively as a team. You know those trick questions they give you when you're doing the HR and they start talking about will you work alone? Or we know they give you all these bunch of questions. Do you work alone? Do you need a team? Will you call your supervisor? No. That's the answer you're going to give. Okay? No. Okay? Will you help others? Yes, all the time. Would you stay late? Of course I will. See? Okay, so executes job assignments with diligence and skill, no errors. Did you hear that? Diligence and skill. Diligence as in follow up, skill as in nothing wrong with it. Scrubbed it clean, ready to go. No dirty claims out the door. Right, y'all? Okay. Assist other employees when needed. See, I just mentioned that. All right, so those are pet peeves in billing. You know, most supervisors, they ain't see you a team player. They ain't gonna fool with you, all right? So I want y'all, when you get in there, be a team player, all right? You want to talk about your coworker, go on downstairs and don't tell nobody. Don't tell nobody. Go in the bathroom and talk about it like a dog all you want to, but don't tell her and don't tell nobody else, okay? Because that's gonna get you into trouble. So don't do that, okay? You want to scream? You go in the bathroom, okay? So in chapter 1, I can't believe it. It's almost 7:00. In chapter 1. You're going to read about self-pay patients. You're going to read about cash flow, self-pay patients, as in the patient is being balance billed, okay? Or the patient didn't pay the copay, so we send them a bill, okay? This is a good one. Federal and state insurance programs require the provider of service to submit claims for the patient. Other insurance payers may see claim submission as the patient obligation. Federal and state. What's federal and state, y'all? Medicaid, okay? Federal, Medicare. Okay. Although most healthcare insurance submit all claims for the patients as a courtesy. Okay. As a courtesy. Okay. The insurance billing specialist must submit insurance claims promptly, ideally within 1 to 5 business days. So check this out. That's ideally. If the provider has not signed off on the report, the claim cannot be submitted. Once he has signed off, the claim can be turned over, checked, scrubbed, clearinghouse, and submitted. Okay, so the 1 to 5 days, that's what the ideal days are for us. I want my biller to turn that claim over the same day. Trust me. But sometimes that don't work. But that's the goal. Okay, y'all, that's the goal. You want to be your supervisor's pet peeve? See if you can kick that to 1 to 5 days. I don't care if you have to call insurance 5 minutes after the surgery. Okay? Cash flow. Cash flow is the amount of actual money generated and available for use by the healthcare organization within a given period. Now, cash flow is still in the financial department. Most of the cash flow that's coming in there, we usually have some left over. Cash flow to us is called overhead. Overhead expenses such as salaries, the rent, supplies, insurance. All these different things must be met, and they call this cash flow. Normally, if I don't have time to get something, or I want to get something for you guys, I'll give it to the supervisor and she can use my card and go get what she needs to get. That's pretty much the cash flow. Okay. The overhead is we talking about the lights. We have to make sure this paid, make sure that paid. The light bill comes in. There's somebody in accounts payable who always takes care of that. Okay. I know it's a lot. The accounts receivable, okay, for a healthcare organization is the total amount of the money owed to the organization for healthcare services rendered to the patient. Accounts receivable, as in the patient has already came in and saw the provider. Now the doctor is ready to receive his accounts receivable. I am ready to receive my money from the account that she owes me from. Can you guys decipher that? Don't worry about it, because when you get your book, you are going to read chapter 1, and this is what it's going to tell you. Okay, here's my favorite picture right here. I hate you guys can't see this, but it's because of, we can't copyright type of stuff. I can't show it to you like this. But when you get your medical insurance billing book, you don't have to get the 17th edition. Try to get the 14th, that's fine. The 14th might be $3. Try thrift.com, okay? Educational training requirements, a high school diploma or equivalent, and a previous experience in a healthcare setting may not always be enough for positions as insurance and billing specialist. You have to do this work. It says typically a post-secondary certificate or an associate degree is required to enter the field. That is old school. Okay, you do not need that to be a medical insurance biller. Okay, you could study for medical billing and take a test from CPC, CPMB, and be a certified professional medical biller with no college degree. Okay, so just take that in mind. Okay, and you get a certificate for this class. Those of you who are in my class, you guys, you get a certificate of that when you actually finish everything. Okay. Okay, so medical billing and coding program curriculum. Okay, so they're giving you the medical billing and code program curriculum, because remember 12 and 13 has ICD-10 and also has coding. So they have a small area in this book that will show you some ICD-10 and CPT. I moved that section to your coding section so you can just study on medical insurance and billing. So we are not going to go over this, okay? No, you're not going to do 13, not going to do 12, okay? But there's an overview in here. Billing and coding professional certification. They're just telling anatomy, terminology, pathology, pathophysiology, CPT code, and Higgs Picks. You guys already know that already. But you can look at those chapters if you want to. If you want to do them twice, do them twice. If you want to do them ahead of time, let me know. Just go ahead and do it. Those of you who are in the YouTube course, you can read and do whatever you want to do, but I want you to still stay on track with this first day of this course. My Sapphire students, you guys have tests to do for this, okay? You have tests to do. Send the test back to me, okay? And you have summaries to do, okay? You guys who are on YouTube, who are self-study on your own, make sure you pay attention and keep up with what you're doing, and make sure that you have a notebook to write in. Make sure you have your cards. You don't have to get your books all at one time. Just take your time. Take your time. Take your time, okay? Basic math. I do have a math test for my students. The basic math test that I have is calculate fees and adjustments on insurance claim. That's a copay and a deductible that we do. That's in here. So my YouTube students, look in there, look at my videos. That deduction calculation is in there. Get it. I want you to study it, because I had a couple of students who went for medical insurance billing, financial counseling, stuff like that. And, for some strange reason, they didn't even give them a test. They asked them that one question: how do you calculate the 80-20, what the patient is responsible for? Look in there and get that. Okay, I'm gonna find a link. I'm gonna find a link for you, and I'll post it in here. I wouldn't have a pin up here, right? Y'all remind me if I don't post that link with that deductible in there. Let me know. Just for my YouTube people. Sapphire, it's in the portal. It's going to say deductible calculation. YouTube, I'm going to put a link in there for y'all, all right? Okay. I can't believe it. The hour. I'm almost an hour already. I only can do it for an hour. Excellent communication skills. You know what? Let me move over a little bit. Okay, so as far as the communication, we used to also have a class for customer service. I still do customer service. I have the class because there are some facilities that do give you tests involved in, with customer service. Okay, so and I can see when I share my screen, I can't see if anybody's sending me a post or not. So if I haven't answered anybody and you guys send me a question, I apologize for that because we've been in the book. Uh, um, yeah, that customer service, I'm going to show you guys that if you want to know certain things about customer service, I have also tests with that. I have that book, and it has everything in it. If anybody wants that book on customer service, let me know. Especially you're who building doing your own business in X, Y, Z, and you need a little brush up on that customer service. Let me know. And you guys remember yesterday I gave you the PDF of Bank of America's business plan. Make sure that you guys go ahead and use that if you are doing your own business, especially medical insurance billing. Just make sure you follow the class and follow the course. Like I said, today is medical insurance billing day. That's what we following. The book, again, make sure you get the book. You can go to thrift.com and get that book. Okay. So I'm going to share again. If I miss a comment that somebody sent me, send it back again. I'm just going to go ahead and put this one up. I think it's this one. Well, that's the book right there. I don't want to do the book. So I'm just going to move over to the task that we do. So this is the only way that I can give you some of this task for you guys to do at home. This is for my YouTube students. Sapphire, you already have this, okay? So this is what it says, guys. The Sapphire physician coding that you're hitting. Your student's name, your date. Instructors, Mrs. Lambert, that's me. Y'all know my name, Sapphire Physician Coding, okay? Skill training program is Sapphire Physician Coding, okay? Medical insurance billing, basis of healthcare insurance, okay? True or false? If the physician no longer wants to treat an HMO or a PPO patient, termination is handled according to the same method that is used when discharging patients who are insured under private insurance. True or false? I ain't giving you the answer. Okay, next one. A subscriber of an insurance policy may also be known as a policy holder. True or false? Next one. Workers' compensation. I'm just skipping. Workers' compensation insurance covers all off the job. Y'all know the answer up to that. All off the job injuries. Okay. True or false? I don't know where they generated questions. Why would they do questions like that? Okay, let's do multiple choice. I'm giving you an example of how Sapphire tests are. Okay, when does the physician's patient contract begin? After the physician has examined the patient for the first time, when the patient steps into the examination room to be treated, when the physician accepts the patient and agrees to treat the patient. A, B, or C. Okay, so that's what the tests look like that Sapphire gets. And this is the same thing that I'm giving you guys from the medical insurance billing book. So the Sapphire students take this test. This is a test that they take after every chapter. So let me get back in here. So the Sapphire students, they take that test after this chapter that they're getting ready to do now. YouTube, what you're going to do is when you get your exercise book, your 4D book, so you have your workbook and then you have your exercise book, you are going to read that chapter, you're going to do your workbook. Read the chapter two in your workbook. Okay? That's what you're going to do. Okay? The only difference between you and Sapphire, Sapphire has to do those tasks and the workbook. Sapphire has to do those tasks and the workbook. So, Sapphire, if some of you do not have your medical insurance billing book, you are starting on medical terminology because you do not have your book. Same scenario. Sapphire does chapter one, medical terminology, language of medicine, chapter one in the exercise book, and the tasks. That's what they do. They have an option. They don't have to necessarily do the exercises in the medical terminology book because they are so long. Each one of their medical terminology tests has 50 questions on 21 chapters. So they don't have to do the exercises. YouTube, you will do the exercises in the medical terminology book. The medical terminology book is about this big. No, I don't have it because I got ebooks. But go find that video. It's in there. Okay, go find that video. I'll put it in there. I'll put it in there. I'll put the book link in there if y'all don't find it, and I'll put the other link in there that I said I was going to put in there. Okay, now I forgot what it was. I got to remember it. I'm gonna put it in here so I don't forget. Uh, I'm in my what do you call this? Just the iPhone notes. Okay, I want a new note. Y'all know how I get savvy with this stuff. I want a new note. Okay, and then the new note. That's what I want to put. Okay, so what did I say, y'all? The books link. So remind me to put the books link in there. What was the other link? Um, I can put the video in there for that. All right. Okay. The Elsevier link. Elsevier link. The Elsevier link is for the books. Okay, that's the Elsevier link. Now, when you go to Elsevier, they got new books. They got new books. But let me know your school. If you guys are on YouTube and you're doing it too, the Sapphire students get 25% off of those books if you get your book from Evolve and Elsevier. Your school is Sapphire Physician Calling. Okay, they'll give you the code to the school. Okay, you know how you put in for a college degree and you can't get the financial aid unless they know the school code. That's the same thing. My school code will come up in Elsevier. Okay, so they can give you that discount. Okay, so and that's just pretty much how those courses go. But as far as medical insurance billing, because that's what we're on right now. Okay, so I'm just going to go back to right now. I'm getting ready to go to. I'm going back to the Sapphire portal. I'm going to the Sapphire portal because I'm pulling up one of the tasks, and that's what we're pretty much going over in medical insurance billing. We went over a little bit on the book, but right now I'm going over some of the tasks. Okay, so those of you who are in the Sapphire class, your medical insurance billing tasks are only up to 30. Okay, you got 30 questions for each chapter. Okay, your medical terminology, there is 50 questions for each one. Okay, so you have something in there for matching. Okay, so for my YouTube students, um, they have matching. You also have matching in your exercise book. Okay, so that's what I'm going to go over. I'm just going to do like one government-sponsored program that provides hospital and medical services for dependents of active duty uniformed service members, military retirees, and their families and survivors of uniformed services. Okay, these are your choices. Independent Practice Association, Medicaid, State Disability or Unemployed Compensation Disability, TRICARE, Workers' Compensation Insurance, Champ VA, which is old, they changed that, but there's some people still use it. Health Maintenance Organization, you guys know what that is, Disability Income Insurance, and Medicare. Okay, so they got 5 questions like this. A form of health insurance that provides periodic payments to replace income when the insured is unable to work as a result of illness, injury, or disease. Okay, it's going to be one of those multiple choice questions. Okay, so so you guys already have this. So this is the gist. When you let me get back over here. When you if you decide to purchase a course, sapphirecoding.com, click on bookstore. When you click on the bookstore and you purchase the medical insurance billing course, those tasks come with that course. So what I'm going over right now, you would be going over. Just like just like I said, I'm going over the medical terminology. You will have your medical terminology book. I'm going over the medical insurance billing on the YouTube. You should have your medical insurance billing book. It's just like you were sitting in the classroom. So remember how we just went over medical insurance billing? If you had your books in the classroom, I would be standing at the forum in my classroom and have my book. So for my YouTube students, just think of it as you are in the classroom. For my students that are Sapphire, same thing. Same thing. So for the next chat is going to be Monday. We're going to still be on medical insurance billing. We're going to still be on medical insurance billing because I want to go over a couple of more things in that. Okay. The medical insurance, we're going chapter 2. We're going on chapter 2. So medical insurance billing, just make sure that you have your notes, make sure that you have your index card. The gist of it is to put you in the correct place. When you have a class in school and you go to a class in college, let's say you do a medical insurance billing. The class is normally 45 minutes to an hour. It's 45 minutes to an hour for a class, right? It's the same thing. Your classes here, we're not going to do the classes for more than an hour. Okay? So Monday, what was it, y'all? Monday, Friday, and Saturday, 6 o'clock. We will try to be consistent with that. If I don't make 6 o'clock on the dot, y'all know I'm coming in about 6:30, but the class will get done. Okay? Just make sure you have your books. Okay, so this is for the YouTube students. I'm just going to go back in here just to kind of give you more of an idea of the exercise book because you guys are not in the course. If some of you, like I said, you want to get the course and you still want to do independency, this is your go-to. Make sure you're at the YouTube. Monday, Friday, and Saturday is when I'm going to be doing the class. 6 o'clock. You're going to follow me just like Colorado Technical University, just like Phoenix. You are going to follow me in that sense. Okay. So what I'm going to do now, I'm going to go back to my screen. I want to get the exercise book for the medical insurance billing book. Okay. Okay. So the book that we were just looking in, that is your regular reading book. The book that I am opening up right now is the workbook to that book. Okay. And in this workbook, they have copies of intake sheets, documentation sheets, and this is going to help you, help you retain. Even if you're not in the classroom, you do a chapter, do an exercise. Okay. Let's go to Medicare because they messing around with Medicare. I want y'all to mess around with Medicare. I mean, y'all ain't up to chapter 6, but I'm just touching on chapter 6. All right. So some key terms in Medicare. Okay. Adjustments, advanced beneficiary notice. You guys know what that is? Let me put it down below. Tell me what that is. Tell me what that is. Advanced alternative payment model. Approved charges, assignment, beneficiaries, benefit period. Tell me what that is. Center for Medicare and Medicaid Services, conditional payment, correct coding initiative. I want to know why did they throw this in here? Do that too, because that's going to be in that same chapter 6. Okay, that's on one of your tests. I got that on one of your tests. Okay, crossover claim, custodial services, disability. Donut hole. Give me a sentence on donut hole. Dual eligibility. Give me a sentence on that. Durable medical equipment. Electronic remittance device. No, just donut hole, and dual eligibility. End-stage renal disease, that's going to be part of your coding. Okay, we're going to do a lot of that. Generic drugs, home health aid, hospice, hospital. All of these things, hundreds. Medicare Part A, Part B, Part C. What's Medicare Part D? Y'all tell me what Medicare Part D is. Medicare Select, Medicare Summary Notice, Medigap. What's Medigap? Y'all can send it to me. Tell me what it is, okay? These are abbreviations, key abbreviations, okay? YouTube, this is for my YouTube students. This is in your exercise book. I'm going to tell you what the book is again. Workbook for, okay, medical, I can't even say it, insurance and billing, okay? Linda Smith, okay? Ford Needs Medical Insurance and Billing, book by Linda Smith. Does not have to be 17. You can get 14 or 13, okay? ABN. Okay, so in your exercise book, they want these abbreviations, and this is what I'm saying. You guys who are on YouTube, follow the class as they are done. If you guys look at 70 of my videos, most of my videos are not teaching the class like I am doing you today. Most of my videos is giving you the heads up of what's in the class, what you're going to look forward to, what is medical insurance billing, what is CPT. Use these codes, use those codes. How many codes do you need? That's what a lot of those videos are for. I've never actually done the class on the YouTube because this is for the Sapphire students. But I've made it this way so that the YouTube students can take advantage of it as well. Even if you're not in the classroom, if you want to go further, you have to get the courses that the students have for the Sapphire. But buy those two books, you can follow the same way that I'm telling you right now. I want to know what an ABN is. What is APM? What is CCI? Okay, that has to do with coding. What is CMS? What is DHHS? What is DME? They're actually used. What is ESRD? These things that I had just mentioned to you a little while ago are pretty much those abbreviations. Okay, but again, PPO, NPI, PPS, PSO, RA, RAC initiative. Give me a sentence on that. RBRVS. Give me a sentence on that. That's on the test. They're gonna ask you what that is. They're gonna ask you what that is. They might give you a calculation for that. Okay, so this book is amazing. Medicare is administered by the federal agency. Medicare Part A is blank covered at Medicare Part B is blank covered. Let me tell you something. You guys are going to learn from this book. You want to know what medical insurance billing is? You have to get this book. Okay. Why, Miss Lambert? Because you're going to save yourself $20,000 from going to a school for college when it's not going to mean nothing when you have to be certified anyway. You don't have to be certified medical insurance billing. You do have to go to at least a 5-month course. In my course, it's more than 5 months worth of work for you guys to do. But if you guys want to be a certified professional medical biller, then you need to make sure you steadfast on this book. And you do need to know a little bit of coding. That's why your chapter 13 and 14 consist of ICD-10 and CPT. Okay? So again, this is for you guys who are doing the medical insurance billing. Okay, so that's where we are starting with medical insurance billing. In the classroom, you guys are starting with medical terminology, and that's only because you don't have your book. I would prefer that you start with medical terminology and medical insurance billing. An hour for medical terminology, hour for medical insurance billing. Why, Miss Lambert? Because it'll push you along in your course. Push you along in your course. I have a 20-week course, 40-week, and a 6-week course. You guys who are doing the 10-week course, the 10-week course is my 20-week course doubled. You're doing double work. Look at your schedule. Okay, my YouTube students, you guys don't have a schedule, but I put the schedule in there. If you want the schedule, let me know. I have a specific schedule just for YouTube. It's a little bit different than the Sapphire students, but it is the same. It is just to keep you on track. I got one in there. Let me get the link. I'm gonna put the link in here. Okay, so get the link. the schedule, because for YouTube. So, because YouTube, you remember a long time ago, I think I did a chat and I was saying something about YouTube University about 2, 3 years ago. And look at one of my chats from years ago. I mentioned it years ago. I mentioned this, what we're doing right now, years ago. Tell me how it's finally happening. Yeah, I'm making time. We're gonna get it. And this course is the course that I have been talking about in that chat from 3 years ago, the YouTube University thing. You see how Kanai came up with the Streamer University? Man, he had the money to do it. He had the money to do it. He had the money to do it. Now he's going to do something else. Let me tell you something. Streamer University is, I think it was amazing. I think it was amazing. But YouTube, you can find anything you want on YouTube. But this course, I want you guys to steadfast on this. Okay, steadfast on this. Your medical terminology book and your medical insurance billing book. Remember, let me get it, just in case you forgot what the medical terminology book is. We went over this. We went over this last night. We went over this last night because remember, Monday, Friday, Saturday. If you guys did miss it, I'm gonna go over the step-by-step book. The step-by-step book that you need for this course is Bucks 2025 step by step. You don't have to get a new one. You can get a used one. Okay, just as long as it ain't changed too much. Okay, if anything, the pages might be a little off, but the books are very expensive. You get this book brand new, it's like $120. Okay, so that's why I wanted to make sure that the course wasn't an outrageous price where you can't even buy the books. Okay, that's why I give you the Language of Medicine book. The Language of Medicine book is edition 13 by Davy Ellen Chabner. Okay, it's called The Language of Medicine. Okay, now let's get to that workbook. Okay. Where's the workbook? Oh, okay. So step by step workbook. My YouTube students, you're going to get the book and you're going to get the workbook. Okay, step by step medical coding. That's the book that's going to show you how to code. Okay, so even if you guys are working, just try to follow a schedule. Follow your schedule. The 20-week schedule bumped into the 10 weeks. You are doubling up on work. That's what you're doing. You're doubling up on work. Okay. I'm going to go into, I know you guys can't see this, but I'm going to go into, I have to close this. All right. I'm looking for the schedule. And the reason I'm looking for the schedule is so I can show you guys what I'm looking for. Okay. So these are all the tasks in here. Okay. Today we're only doing basic health insurance. That's the one that we just kind of went over a little bit of. And that's what you're going to do for homework. My YouTube students, that's what you're going to do. The Sapphire, you should be past this by now. This is for my YouTube students. Basic health insurance, you're going to do your first chapter, and then you're going to do the exercises when you get your book. Okay, when you get your book. Okay, that's what you're going to do. Okay, Monday we're going on electronic data. We're going to the second chapter. Whatever the second chapter is, that's what we're going. Okay. I'm looking for something. Let me go to the Sapphire portal. I'm looking for syllabus schedule. That's what I want. I want the 20-week schedule. All right. So y'all who in Sapphire, y'all who in my class, and y'all look at that 20-week schedule. Y'all see that it says 6 to 20 weeks. Ebony, you see it says 6 to 20 weeks, right? So the 6 to 10 to 20 weeks is just tripling up on work. The 10 weeks is double. The 6 weeks is triple. So I gotta make it bigger. I can't see it myself. Let me make it bigger. I know. Ebony, make it bigger, Miss Letha. I'm making it bigger. Hold on. I know y'all can't see this, but we're talking about the schedule. And the schedule, that's 20 weeks. YouTube, there is a schedule in there already. I'm not sure which one it is. I'm thinking it is the schedule that I made for YouTube a couple of years ago. Nothing has changed. It is the same schedule. It's the same schedule. This schedule is for Sapphire. It's a little bit different because there's more work on it because they get hands-on tasks. Okay. So the first week is orientation. That's what it says on the schedule. It's orientation. There's no date on the schedule because I took the dates off because it was too much for me to keep changing the date schedule for you guys. It's not an automatic thing. I have to physically do it. And Rennie's just not doing it. Administration, they have the mountain of things to do themselves. They have to grade some of the tests that come in on me. I don't do the grading. She does some of the grading. Okay. Let me see. I'm not sure you can see it. I'm pretty sure you can't, but I just wanted to kind of address to you how the courses go when it's a 20-week course. You're going to do, see, in week three, in week three is medical insurance billing, okay? Medical terminology, okay? Medical insurance book, 9 and 10. Okay, it says read assignment, review your course, okay? Student file, okay? And that's pretty much the same thing. If we go down and let's look at week four. Week four, CPT and ICD-10, capstone. The capstone, medical insurance billing, medical terminology, and ICD-10. The capstone is going over everything that you did. Once you finish going over everything that you did, it's time for me to give you that comp. Okay, it's time for me to give you a competency. That's what the capstone is. So Ebony, if you look on your schedule, that's what it is. Haley, same thing. All y'all the same thing. Kiana, same thing. Look at your schedule. Okay, I got your message, Kiana. I'm gonna answer you tonight. But check out your schedule. Make sure you guys follow your schedule. If you fall off your schedule, just hit the YouTube. Just hit the YouTube if you fall off your schedule. But let me know so I can put you back on. I can put you back on your schedule. If you take the test and you don't and you fail it, then you might have to do a couple of things. I know. I just love this background. It just drives me nuts. Okay. Now I have to worry about the garbage can in the way, and then I flipped around towards the back of my kitchen, and then I moved to the other room. But it's nothing in there. But anyway, make sure you guys do that, okay? Look at the schedule. YouTube. Look at the schedule that's in the YouTube. Let me find it. I'll put it on here so I can remember to make sure I do it. Okay. Post the schedule link so I don't forget. All right. So I'm gonna look at this video as soon as I finish. I did something different, which I still don't think that we're able to see it. The only way you can see this because of the copyright issue is through the Sapphire portal, because that's a school portal. That's where I'm teaching from. I'm showing you things from here. So I think the reason why I probably can't share the books and stuff like that is because of the copyright. It just doesn't let you do that. I probably can ask, can I share the book with you? Because it would be redundant for me to hold up the book we're not doing that. I need for you to share the book with you guys, and then I can take a pen and highlight whatever I want on it. But I can't do that unless I have the right to do that. So I know what to do. Kindle. You guys, I don't know, I got something on my glasses. Kindle. I don't know if I did it for you, YouTube. Kindle has books in there, CPT books. All of the books are in there, I do believe. I'm going to go over that link in the Sapphire portal right now so that I can see it. Let me make sure I remember, maybe I get it. Get the link. Get the link for Kindle. I'm gonna put that in here too. So I am going to still be working on this. I got 2 minutes in. I got to finish in a minute and change. I'm going to get that link and put it down on the bottom. I think I can do the Kindle. I don't even remember how to get in the Kindle. I want to see something. It says I'm sharing my screen. So when I share my screen, I'm gonna try to see if I can get it. I don't know if I can get it. I have to sign in and all that kind of stuff, you guys. I don't know if you guys can see me, but yesterday, what you call it, Kindle, Amazon Kindle. I have it already. See, I don't have time to do it. I got like 5 minutes. I got like 1 minute left. I got 1 minute left. I can't even do it. Okay, let's see. So we're still sharing, but you probably can't see it. All right, I gotta sign in and all that kind of stuff. Okay, so we're not doing all that. Right. I gotta get that ready for you guys next time. What I'm gonna do is I'll probably do a test run to see if you can see the Kindle books. Um, they free, so why would they give us a problem? My books are not free; those books cost a lot of money, and I think that's why they're not letting me share them with you guys. Um, Emily, did you go over with us with the Kindle books? Kiana, you did. You guys, but see, that was we're in the classroom, so you guys can see it in the classroom. So YouTube, don't fret. I'm gonna figure out how to get you guys to see some of those books. But don't forget to get your books for Monday. Monday we're going on chapter 2. From today to Sunday, you guys can go ahead and work on your medical insurance chapter 1. Work on chapter 1. If you can get the books, get the books. If you get them from Kindle, get them from Kindle. If you're going to do ebooks and do Elsevier, boom, you have your books right away. Remember, you're not paying $20,000 for a course. You're not paying $2,000 for a course. I'm telling you what books you're going to get. Get your medical insurance billing book. Get the workbook. Go back to this video. It is chapter 1. Go back to chapter 1 so you can go over that. The next class that we are going to do is Monday. I think it's Monday at 6 o'clock that we're going to do. So we're going to try to make sure we be on time for Monday at 6 o'clock. But don't fret. You can always look at any other video that you want. We just want to make sure you stay on the right track. So we're doing these 3 days. We're doing the 3 days, hour. You're doing more than that because you are doing the work. Okay. So check out your schedule and see where you are. I'm going to print that schedule out right now. And I'm going to find the other one that I had for YouTube. Okay. So I'll talk to you guys later. I'm off. I can't wait to look at this video. I changed something to see if I could share it. If they don't let us do it, then I'm pretty sure it's a copyright issue, y'all. Okay? If you guys watch this video in its entirety, use key code hashtag key 212. It takes off $1,150. This is for you guys who stayed to the end. Bye.